My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences. Welcome, everyone, to today's HHS Town Hall on Thursday, June 3rd. Our President and CEO, Rob McIsaac, isn't available today for he was at a regional planning meeting, so our Executive Vice President, Clinical Operations and Chief Operating Officer, Sharon Pearson, will be introducing things. Before Sharon gets started, just a quick reminder that you can ask questions. We'll have a dedicated Q&A session at the end about all the presentations. In the meantime, if there is a question that comes to mind, you can always use the Q&A button at the bottom of your screen to ask that question, and our panelists do a wonderful job responding throughout the course of the presentations today. And of course, at the end, you'll have a chance to ask additional questions or ask one live. We just ask that you please use the Q&A button for questions. We'll reserve the chat function for celebrations, which will conclude today's town hall. So Sharon, without further ado, over to you.
Great, thank you very much, Aaron, and good morning, everyone. Thank you for joining today's town hall. Typically, our remarks focus on items related to the pandemic, but today I want to begin by addressing the discovery of the remains of the 215 children at the former residential school in British Columbia. There has been a national reaction to this tragedy and outpouring of collective grief that I know we all share. At Hamilton Health Sciences, we have lowered the flags across all of our sites, and at our McMaster Children's Hospital and the Ron Joyce Children's Health Center buildings, we have had those lit up in orange, as you can see in the photo. Today, I would like to read our land acknowledgement and then invite you all to participate in a moment of silence to commemorate the lost lives of these poor children. We're privileged to provide care on the lands of the Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. Please join me in a moment of silence. Thank you, everybody, for sharing in that. I just have a few more comments before I provide my usual operational update. Earlier this week, Michelle LaRue, who's our VP for Human Resources, also issued a message to recognize Indigenous History Month along with Pride Month. There's a message available on the hub and also a link to more information about the land acknowledgement and signs of welcome across all of our sites. During the month of June, we will also display the Pride and the transgender flags at our hospitals and share stories and resources and other materials to advance our understanding and our knowledge. We're also going to take time at these sessions at the town halls over the next few weeks to further recognize Indigenous History Month, Pride Month, and also Indigenous Peoples Day, which is on June 21st. So our agenda today is all our regular updates, but we have a special guest today. We have invited Dr. Ellen Lippman, which many of you will know. She's the chief of the Department of Child and Adolescent Psychiatry at McMaster Children's Hospital. And Dr. Lippman is going to speak to us today about children's mental health during a pandemic. So we welcome Dr. Lippman today. We'll also have our regular update from Dominic and our regular update from Bruce Squires as well. Time for question and answers, and then very important, the celebrations that we usually all participate in. So with respect to an operational update, I'm glad to say the word positive in my update. I don't think I've said that too frequently as I've talked about the operations, but we've all seen the trends across Hamilton and across the province and somewhat nationally, but not everywhere. But certainly we're seeing the infection rates decline, and Dominic will add a lot of the commentary to that. We see our vaccination rates increasing, which is wonderful. And then for the first time in a long time, I'm happy to report that we have no outbreaks anywhere across HHS, which is wonderful. So Again, preempting the celebrations, but for the infection control team, for Cindy O'Neill and Dominic, customer support, the group that helps manage us through these outbreaks, cannot thank everyone enough for helping us get through. From a critical care capacity right now and where we're at with COVID, so again, I like to remind people every week of the numbers. Right now, we have 35 patients in the ICUs with COVID or COVID-related critical illness. Recall, we opened 38 beds to support COVID activity. This is the first time I would be reporting that we're under those 38 beds. So that is good news, but we are really hopeful that we start to see those ICU numbers decline, because our ability to ramp up, which we'll talk about in a minute, is contingent upon seeing a decline in our critical care numbers. Our ward numbers have leveled off pretty substantially. Today, we have 26 patients across our organization. Again, the demand in terms of a resource right now remains ECMO. This is an intervention that we are seeing with high utilization during this portion of COVID. And again, reminding there's only a few centers in the province that provide this level of care, and HHS is one of those centers. And we have started our program with 2. We have gone as high as 10, and we are being asked to see what else we can accommodate. So it is a really critical intervention for patients, and we're doing our best to respond to the needs we're seeing in the province. There's a lot of conversation happening right now about how we continue to do the census balancing, more of a shift from the provincial balancing to how we balance across our city and within our region. And if we go to the next slide, in terms of what it means, as I just referenced, it's really critical that we have our ICU numbers decline so that we can release our staff back to our operating rooms, back to ambulatory care, and back to other areas from which they've been deployed, including our very important work of Odyssey. We have been asked, all hospitals been asked by the province to ensure we continue to maintain capacity for COVID, as we are in this precarious moment as we watch the trends with COVID. So we continue to do that. We are working, as I said, with Ontario West and our partners as to how we will ramp down those critical care numbers and maintain availability, and that at the same time plan for how we can increase our operative services. Reminder, last week we talked about the rescinding of the order to ramp down surgical care and an ability to open up to surgical care that did not require inpatient resources. So that's the work that we've been doing for the last couple of weeks. It is very slow. I know people are really anxious to get going. People are anxious to get back to their home units. But again, we need to ensure that we have the critical care capacity before we can move forward with those plans. I will also add that it's a difficult time because not all hospitals are at the same place with respect to their ramp up. And much of that has to do with the type of activity that they provide across the community, hospital, secondary care, tertiary care, et cetera. If we go to the next slide, I just, once again, this looks like the same slide, I think, all the time, but our mobile health unit, we are completed the work. It would be ready to occupy should we need it. I would implore people to have a look at the tour that Aaron's team created, a great visual, and along with a virtual tour. It's really impressive to see the unit. Hopefully we never need it, but impressive to see. And with that, I'll take questions later, but I'll hand it back over to Aaron.
Thanks very much, Sharon, for the update and intro. And next up, we have our epidemiology update from Dr. Dominic Mertz, our medical director of infection prevention and control, to see how things are progressing in this pandemic. Dominic, where do we sit this week?
Yeah, thanks, Aaron. Very similar news as last week, I would say, overall. And as Sharon already touched on, it looks good across Canada, maybe with one exception, which is turning around as well, which is Manitoba. This is the picture from last week. And on the next slide, you see how it looks like this week or a couple of days ago. You see Manitoba coming down as well. They were sitting at more than 200, are now at 165, have an RT of 0.86, so a 14% reduction every roughly 5 days in terms of case numbers. You see Ontario now below 50 with 0.86. And what you also see on the left-hand side, the epi curve for Canada, we are lower than ever since the fall. So we are lower than between the second and the third wave. And you can see, as I mentioned, other than Manitoba, all the provinces are clearly below 100 at this point of time. Next slide, please. This is our Ontario epi curve, and probably sitting this week at roughly 45, maybe down to 40 by the end of the week, depending on how the next few days will go. So that's comparable to where we were sitting at mid-October, or even earlier than that from a provincial perspective. So very similar to what I've shown you from the Canadian perspective on the slide earlier. Next one. And that just gives you an idea of where we are sitting in terms of local epidemiology and during what time periods of higher epi we have had our schools open, but I will not talk politics today, and we'll go to the next slide here. Our hospital admissions coming down significantly as well. Again, the red bars showing you total admissions, very similar to the time period now between the second and the third wave. In terms of ICU admissions, as you can see with the dark red bars there, certainly much better than at peak, but still we see a much higher proportion of ICU patients than we've ever had before. So at this point, it's either you're at home if you have COVID or you're in the ICU. There's only a small proportion of people who need ward level care. And the very dark small bars that you can see, number of intubated patients, again, coming down very significantly, but much slower than the overall hospital admissions. And to a large extent, that's due to those patients who came in maybe around peak or after peak, required ICU stay. They stay there for much longer than your average ward patient. Next slide. That's the Ontario modeling, first the older one from April 29th in terms of case numbers. And again, you see the red line here, which shows you what the truth were. So we were somewhere between the green and the yellow scenario, but now actually better than the green scenario was back then. On the next slide, the more up-to-date modeling from a couple of weeks ago, again, doing better than predicted. Again, you see the red line compared to the green line, which was the most optimistic scenario back then. Next slide. In terms of ICU, again, first the old modeling, you can see we pretty much follow that best case scenario here, maybe losing some ground currently. Today we were sitting at 650, which is what this predicted a few days ago. So very close to the green line. More up ICU modeling on the next slide. Next slide, please. Thank you. Shows you that we are pretty much following the prediction in terms of decline in ICU or required ICU capacity for our COVID patients. So again, on the right track, but it takes time. It takes more time than the case numbers. It takes more time than the ward beds. Next slide. The Hamilton view here, we had that steep decline over the last week, which was overdue compared to the province after we had that shoulder there a couple of weeks ago. We are still among the health units with the highest case numbers per population at this point, but most certainly also on the right track, as you can see, with case numbers continuing to decline, slower now, but still going downwards overall. Next slide. Hospital admission locally looks relatively similar to what I've shown you at the provincial level. We are at less than 50% of where we had been in terms of COVID patients on the wards. ICU, again, still lagging behind, as you can see with the darker red bars here. So in terms of ICU, we are sitting roughly where we had been 2 weeks prior to the peak. And as you can see, it takes roughly double the time to get down from what took 1 week to go up. So that gives you a crude idea how quickly or slowly ICU capacity will improve over the weeks to come. Next slide. I showed you the roadmap to reopen last week with the goals that we have in terms of vaccine status. We already met that 60% a week ago. This is from yesterday with the data from 2 days ago. 68.9% of all adults had at least one dose. 6.4% in the province had or are fully vaccinated. In the meantime, you can probably add roughly 2%. So we crossed the 70% for the adults with single dose at this point of time. Hamilton lagging a little bit behind because we hadn't been part of the initial targeted vaccine strategies, but very close with 66.2% of all adults with at least one shot and 6.1% with 2 shots. So I would say the AstraZeneca in particular clinic over the weekend contributed significantly to that uptick that you can now see in fully vaccinated individuals in Hamilton. Next slide. That's how we compare to the world, and Canada is now of the larger countries, I would say, this in second place behind Israel in of the share of people who received at least one dose of the COVID vaccine. We just overtook the United Kingdom a couple days ago. So that's all great news. I think the challenge are on the next slide, which is the fully vaccinated people, where we are still lagging behind, very significantly behind those other countries that I listed here: Israel, United Kingdom, and the United States, with United Kingdom and the United States both sitting at 40% of the population fully vaccinated. Israel close to 60% there, and us sitting at that around 5-6% range. As I mentioned last week, we roughly vaccinate out on the second vaccines, it will take roughly a month to get you and sitting at. Next slide. Next slide, please. My apologies, I just got disconnected, but I'm back. So hopefully people can hear me.
I can hear you, Dominic. I know.
Okay.
I think we might each be experiencing some network issues. We'll try and do our best, but I can hear you, yeah.
Okay, perfect. Then I will continue. Thanks, Aaron. Now, the main concern at this point, obviously, is not our speed in terms of how quickly we get people vaccinated, where we are doing a great job currently. That's out of question. The main concern that you hear about and read about is that so-called Indian, or using the new WHO nomenclature, which we should be using more moving forward, the Delta VOC. This here gives you an idea of the situation in how those variants of concerns compare, and how many of those we have in Hamilton. And as you can see, the UK or B117 is now referred to as Alpha, and that's the vast majority of what we see in Hamilton. That's still the vast majority of what we see across the province, with roughly 4,900 confirmed cases in Hamilton. There's more, but we don't test every single hamlet. South Africa, Brazil, beta and gamma, which have some level of immune evasiveness, are pretty irrelevant for us. And I think when you go to the next slide, I will simply forget about those two. They don't seem to be able to compete with the B117, the alpha VOC, because of the higher transmissibility that alpha has. Now, the issue with delta, or B16172, is that it seems to be even more transmissible than alpha. Estimates being in the range of 50%, some suggest 30s, others 70, up to 80% more. So very similar story that we have had when alpha came along. Same ballpark in terms of increase in transmissibility there. There's some level of immune evasiveness, as you probably heard, with the first vaccine in particularly not being as effective, it seems, compared to alpha B117. But once you're fully vaccinated, the efficacy seems to be very similar to how effective it is for our alpha strain. Next slide. So getting an idea of how much delta we have in the province, to some extent it's guesswork at this point of time, because only a proportion of those isolates that we have get typed to that extent. One relatively easy way to identify alpha is to say, okay, whatever's not screened positive for VOC, so that's first and foremost our alpha, our B117, presumably is a delta, or the vast majority of those is a delta. That's not a perfect approach, but a rough approach we can take. And if you use that approach and you look at Peel Public Health Unit here, over this time period that I'm showing here, we see a steady decrease in terms of the proportion that tests positive in the screen for VOC, which to the vast majority are the B117s, the alpha, the UK variant. While we see an increase of those non-variants, but those are not non-variants. To a large extent, those are likely the delta VOCs. When you look at Hamilton on the next line, you would see we are pretty stable, or actually see an increase over time in terms of B117s, which at this point is a good sign, because it means that we have less delta in the system. Toronto lying somewhere in between. And just out of interest, I added here in yellow the data for the week of April 28th to May 2nd, and you would see Peel was at 93% VOCs back then, so that's pretty much 93% B117 alpha, and that dropped to 76.2%, and that's probably the effect first and foremost by delta. Hamilton, we still continue compared to where we were at the end of April, and Toronto, a slower, but also a decline in terms of the previous VOCs. So clearly showing that delta starts to take over in the province. And it's estimated at this point that roughly 1/4 of all our positives across the province are delta VOCs at this point. Next slide. So why is that a problem? And you've probably heard about the situation in the United Kingdom. And what you see here is the epi curve smoothed for Canada and the United Kingdom, cases per 100,000 per week. And when you zoom in the next slide into that tail end there, you see that the United Kingdom is slowly coming up while we continue to decline. And it looks like in a few days, we may be in a similar range in terms of our case numbers. And this is to a large extent, or probably close to 100% due to delta, or driven by those delta VOCs. Next slide. The one area to watch is Bolton, northwest of Manchester, which the epi curve that you can see here shows you that the light blue line, which is the younger population, that's where you see the case numbers increase. That's the population that's less likely vaccinated and less likely double vaccinated. And that's the patient population that's affected. While in the elderly population, which is well vaccinated, we hardly see an increase in terms of case numbers here. And that's sort of what we would expect to see in Ontario as well, that we see this new variant spread first and foremost among non-vaccinated. There's probably an increase as well in single vaccinated because of that low efficacy of a single vaccine, and it shouldn't affect us in terms of those who are already double vaccinated. On the next slide, you will see the effect on hospital admissions. April 2020 surge versus the May 2021 surge. And given the patient population affected, plus some of them partially immunized, you only see a, I would say, relatively minor increase in terms of hospital admissions from on day one when they had more than 10 cases to 1 month later, 40 cases. So it roughly doubled, and things are turning around at this point. And that's what you see on the next. Next slide, please. Here we go. COVID rates fall again in Bolton, and there's other regions now in England that have higher rates than Bolton, but not only because others increase, also because they get things under control in Bolton. Next slide. And how do they do it? Mostly through vaccines. I just wanted to add, despite the Delta VOC that's spreading in the UK, they, for the first time since the beginning of the pandemic, they had 0 daily COVID deaths, and that's what we should all be aiming for, obviously. So that's possible despite the fact that the Delta VOC is another curveball that we have to address, obviously. The epi curve at the bottom here are deaths per 100,000 per population, where in Canada we stay relatively stable, and in the United Kingdom, as mentioned, first time they hit the 0 a few days ago. Next slide. And again, how to do that? It's just as simple as on the next slide, vaccines. So what they ended up doing in the UK was that they started to even more aggressively vaccinate in those regions with high Delta proportions, where they saw the case numbers increase, and prioritize second shots in those areas as well because of that difference in the efficacy. When you compare single dose for Alpha works better than for Delta. So even more important to get those second shots into people. So please, as soon as you get an opportunity to get your second dose, get it. That will be the solution to this VOC and to all the VOCs that we are currently having across the globe. Handing back to Aaron, thank you.
Thanks very much, Dr. Mertz. A very informative update today, and I have to say it rolls off the tongue a little bit better with the adoption of the Alpha, Beta, Delta approach, although it does sound a little scarier, I have to admit. Next up, we're going to talk about our vaccine effort, which is ongoing in the province and the region, and Bruce Squires, our Vice President of Women's and Children's Health, will give us an update on where we're at in that regard. So Bruce, please, over to you.
Thanks very much, Aaron, and good afternoon, folks. I think we're going to have a shorter update today, and I'm pleased by that because I'm certainly interested and keen to hear from Dr. Ellen Lippman. In terms of the vaccine progress, there's not too much new. I have one sort of new piece that I'll talk to you about in a second, but there is progression, and so let's really acknowledge and in some ways celebrate the fact that we're well over 2/3 of adults in Ontario. By this time next week, we will have passed 10 million individuals who will have received their first dose of the vaccine, and we're starting to see significant growth in the numbers receiving their second dose. By the end of today, Hamilton will actually have passed 65% of our adult population. Hamilton's moving at about a 10% increase in the percentage of the adult population that is vaccinated with at least one dose every 10 days. And the province has moved through a million people, 1 million vaccines over the last 8 days. So good progress being made. What's new? Well, accelerating second doses starting with seniors and the 12 to 17. Those aren't new. I did talk to you about them last week, but they continue. Really the main thing that's new was just announced this morning that following the approval of the National Advisory Committee on Immunization of the ability to mix first and second vaccine doses, the province announced just this morning that we would be providing for the substitution of an mRNA vaccine, so that's a Moderna or a Pfizer vaccine, for those as a second dose for those who may have received did receive their first dose as AstraZeneca. Now, important to highlight that would still be at the recommended timeline of about 12 weeks. So that doesn't mean necessarily rapidly moving forward the timing, or as much as folks may have expected with respect to the second dose for those who received AstraZeneca. All of those first doses in Hamilton were provided either in pharmacy or in primary care, and so we know that so far, at the appropriate timeline, primary care and to some extent pharmacy have been offering second doses of AstraZeneca, including at our own site last weekend. I suspect in the next day or two, the province will announce further details on the booking process for individuals who are coming due for a second dose. Including of AstraZeneca, or when they received a first dose of AstraZeneca, including how to schedule those doses through the provincial booking system. So still some details there to be worked out, and we will share those as quickly as possible. If we can go to the next slide, I did want to give you a snapshot just of where we stand in terms of vaccination status across the age groups in the city of Hamilton, and so you can see from this chart that for ages 60 plus, we are over 75% having received at least a first dose, and you can see we're well into the 80s for those over 70 years of age. That's really, really promising. We're also moving quite quickly through other age groups. And if I point you to the bottom there, the 12 to 17, as you know, that was only announced just short of 2 weeks ago. And you can see there's already been 12%, 4,500 children or youth vaccinated in the city. But I can also tell you another, as of late on Tuesday, another 12,000 approximately had been booked for their second dose. So we're moving quite quickly through that age group and population as well. All of this towards really those goals and those important milestones that Dr. Mertz referred to earlier. Go to the next slide, please. Now, just a reminder, our role in vaccination continues to be, of course, through our Wellington Vaccination Hub, but also, of course, reaching out and providing advice to all of our patients and families and the broader community. And of course, here at our inpatient facilities, we have mechanisms arranged for the regular vaccination, particularly important for any new patients who may not have been vaccinated and may be en route to long-term care or alternate levels of care. Next slide, please. Again, spoke to you last week about the youth vaccination strategy, and that continues to move very quickly apace. All youth are able to book an appointment at any Pfizer site through the provincial booking system. Included on that system is the ability to book specifically at an identified youth vaccination clinic at HHS for the weeks of June 15th and June 22nd. And we will also roll out in the next 2 days a very targeted mechanism for that small number, probably 2% of youth who really require very special care and attention, maybe because of sensory or or behavioral or other conditions that may affect really their, let's call it their tolerance or their vaccine experience. So we're going to have an ability to vote for that very small number of youth. But of course, at the youth vaccine clinic in those 2 weeks, which is for a much larger group of people, we will have experts in pediatric medicine, nursing, et cetera, child life specialists to help ease that approach. That's only a couple of the mechanisms to reach children and youth, including targeted clinics for our Indigenous and our Black and racialized populations. Next and last slide, please. Actually, I'm done. So with that, I will very pleasurably turn it back over to you, Aaron.
Thanks very much, Bruce. Great update today. And now we have a special guest with us, Dr. Alan Littman, who's the Chief of the Department of Child and Adolescent Psychiatry at McMaster Children's Hospital, Hamilton Health Sciences. Dr. Littman, welcome. I believe you're going to give us a little bit of an update over what we're seeing in terms of child mental health throughout the pandemic, and maybe some practical tips too.
Okay, thanks. Excuse me. Thanks very much, Aaron. It's a real pleasure to be here today to have a chance to talk at this town hall. Just to start with an overview of children's mental health or child and youth mental health, research tells us that about 20% of children and youth experience a mental health problem. So that's 1 in 5. This is a consistent finding over a number of studies worldwide and in Canada as well. I highlight the Ontario Child Health Study here, the 2014 version, because it gives us really our best Ontario and Canadian data, and it was done by investigators from Hamilton who are affiliated with McMaster University and HHS. What we also know is about 1 in 4 of those who have a mental health problem do not have contact with any service. They don't see their family doctor, they don't see a specialized mental health service. Comorbidity is very common in the world of child and youth mental health. Often children or youth have more than one mental health problem. They struggle in school. They struggle socially, getting along with teachers or peers or their family. And there are also physical health comorbidities as well. In a study looking at children going to a physical health clinic, about 40% identified a comorbid mental health problem. If you look at the Statistics Canada site, you can see that intentional self-harm or suicide is the second leading cause of death for 15 to 24-year-olds, and it's quite similar for the younger age group, 10 to 14. Next slide, please. So the first 2 bullets really are pre-pandemic information. In the decade between 2008 and 2018, there was a 61% increase in emergency room visits for mental health problems for children and youth, and a similar increase in hospitalizations for the same kinds of problems. During that same time period, there was an actual decrease, 26% in hospitalizations for other conditions. So this really illustrates that children and adolescents with mental health problems are increasingly coming to the hospital. Several months ago, we had a look at some of our data from the Child and Youth Mental Health Program at McMaster Children's Hospital, and the last 3 bullets illustrate some of that information. We saw that children or youth admitted who needed medical support after a suicide attempt had tripled over a 4-month period compared to the year before, and they needed to stay in hospital longer because of serious attempts. A youth admitted with substance use disorder had doubled compared to the previous year, and the types of substances that were being used were quite alarming, including opioids. And we also found that the number of children and youth admitted to hospital with predominant symptoms of psychosis had doubled compared to the previous year, and a lot of that was related to significant substance use. Next slide, please. So I think the pandemic has been challenging for everyone, and many children, youth, parents, and adults have experienced an impact on their mental health, not all at the crisis level like I've shown in the previous slide. Mental health challenges during the pandemic can be a result of many things. Things like isolation and boredom that I think many people are experiencing, the day-to-day structure for children and youth of school in particular, or other routines are gone. There may be more tension in a household as children, youth are doing their school at home, and parents are also working from home. There may be anxiety related for some to attending school in person and for others virtually. And some of the typical people who might be spending time with children and youth and might notice changes are not around or accessible. So those would be teachers, peers, coaches, doctors, a whole variety of people. And there may be additional stress as well due to systemic racism. Next, please. So how to cope during the pandemic? These are some kind of practical and straightforward ways I think that can help children and youth and can really help all of us during the pandemic to cope. Having routines can be really helpful, knowing what's supposed to happen throughout your day, planning that out. Regular exercise. Of course, that would be for those who are not restricting diets and who have not been advised by a healthcare provider to avoid exercise. Regular and good nutrition is important. Regular sleep. Staying connected to people that you care about. So increasingly as the weather is warm and we're able to be outside and maybe see people outdoors, that's great. Certainly virtual means, Zoom, phone calls, FaceTime, those kinds of things are helpful to keep you connected. Learning a new skill or activity can be helpful. And notice for your child or youth or for yourself changes in eating, sleeping, or behaviors that might indicate a difficulty. Next, please. So there are a variety of sources of support for our youth during the pandemic. The picture here shows the other side of COVID mental health document that was on the HHS share drive recently and is available to everyone and lists a variety of resources as well. If your child or you are in need of mental health support, a really good place to start is with your family doctor. In Hamilton, there's a hamilton.ca website which talks about mental health resources for children and youth, and Contact Hamilton is another source of getting connected to service in Hamilton. There are a whole variety of crisis supports, Coast Hamilton, Kids Help Phone, Children's Hospital Emergency Room, and 911 are all kind of more crisis resources. And as I said, all of these are detailed in this HHS Share presentation. I think the thing that I would say just to end off is, children and youth are impacted by the pandemic and parents are paying attention to what's going on with them and trying to get help for them. I think it's also important for parents to pay attention to how they're feeling and how they're doing. If you're struggling as a parent, it's hard for you to help your child or youth. So, pay attention to that as a parent, and seeking help for parents is as important as it is for children and youth. Thanks very much.
Thanks very much, Dr. Littman. Great presentation, important topic for us to hear about today, about what's happening with youth in our community, and in particular in relation to schools and the announcement made this week. We have time for Q&A, so you can, look, I want to say at the outset, there are a number of questions answered in the Q&A tab. So if you simply open the Q&A tab and look at the answered column, you'll see that in particular, Dominic Mertz and Bruce Squires have been very busy typing answers in there, covering a wide range of topics related to the vaccine, from second shots to mixing different kinds of vaccine to efficacy, all sorts of stuff. So you can review those in there. And if you still have a question, you can absolutely pose that. You can do it two ways. You can write it into the Q&A tab and we'll ask your question. You can also raise your hand as a participant or a panelist and we'll have someone answer your question. So I also want to address off the top, I see a great comment here from Stephanie about the use of our land statement, which occurred today. Just to remind everyone that may not be familiar that HHS does have a recommended land statement for use, and the guidelines for its use, both of which were developed in extensive consultation with Indigenous partners that we have to the hospital and leaders in different communities that we support. And you can access that on the hub to understand how you might apply that in your own work. Certainly important to do. And there's additional information that's been shared this month in the context of Indigenous History Month. So I just wanted to point that out, and thank you, Stephanie, for the comment. In addition, let's see, I don't see any other questions open in here. Maybe Dr. Lippman, as our guest, I can pose one directly to you. Just wondering, as you think about the summer months and to the extent that families can think about addressing certainly the circumstances that the kids have faced throughout the pandemic. What are some of the more accessible or broadly accessible things you'd recommend parents and families consider trying to do for the children in terms of routine or activities throughout the summer that might pose a positive benefit in light of all the turmoil?
Yeah, that's a great question, Aaron. I think that the things that were talked about in terms of kind of helping during the pandemic are similar things that will help during the summertime. The routines, the exercise, the sleep, and good nutrition should all be part of the opportunity to set up what the summer is going to look like. I think when there's more chances for kids to be out and exercising, at the playground, running around the field, in their backyard, perhaps spending time with their friends, those will all be important things. The isolation from friends, particularly for let's say younger kids who may not have as much kind of social media contact with friends, will be important. So trying to get back to some of the more normal friend and family activities would be great.
Good, thank you for that. Everyone needs a friend, that's the truth. And as between friends, we can celebrate one another. I'm going to suggest we move to our celebrations portion of our agenda. As I don't see any additional questions, just a reminder, you can always submit questions after the fact to the HHS News inbox, which we'd encourage you to do. You can celebrate a colleague, a friend, a team member, or a project or something you've seen in the organization that you think is worthy of praise. You can do that in a similar way to the Q&A. You can use the chat function and type it in. You can raise your hand and we'll call on you to deliver it live. I know Sharon's joined me on camera to help read whatever people type into the chat forum. I know it takes a couple of minutes, so we'll give people time to do that. I want to, first, I know Barry Lum, you have a particular milestone to mark today, and I know you wanted to do that. So why don't I call on you first?
Excuse me, many thanks, Aaron. So Michelle and I both want to celebrate the hundreds of people working on Project Odyssey. And you may have heard us talk about Go Live, but Go Live currently is scheduled for exactly 1 year and 2 days from now. So this is a big deal. Come 1 year from this coming Saturday, we are hoping to go live. So you've heard us say that this is the biggest clinical transformation that HHS will ever undertake in terms of the quality of the care that we provide and enhancing our working environment for everybody. The group has done a ton of work so far as we've been starting this project. And so we just want to reach out on behalf of the Odyssey team and offer a huge thank you to everyone who has given us their time and expertise so far. We are well on our way, and we will be really pleased to have you continue to work with us. I know Michelle wanted to say a couple of words as well, Aaron.
Yeah, thank you, Barry. In addition to echoing Barry's comments for the great support for the project, I really just want to thank as well the 154-person Odyssey project team. They're incredibly dedicated to the project and have been working pretty much around the clock to support the organization for this major transformation. And we all greatly, greatly appreciate you. As Barry said, it's 1 year to go live, which really means 1 year and to day one of a future of unlimited potential. So thank you to everyone for the ongoing Odyssey support.
Good stuff. Thank you for that. See a couple of more hands raised. Bruce and Ralph, maybe we could read a couple of the comments in our chat forum first. Sharon, do you want to start? I see something from Kevin Marley here.
Yep, I can start. So a shout out to the diagnostic imaging MDU and BAC teams at our sites where we just went live with, I think it's Arius, HHS wide on Tuesday. So thank you, Kevin.
Awesome. see one here from Emmeline Grigorov. I would like to shout out to Dina Kloot and Stephanie Rowe-Jans for all their leadership and for sharing their wisdom with the Human Rights and Inclusion team with planning for recognition of Indigenous History Month and Indigenous Peoples Day, which is on June 21st. So thanks very much for that. And maybe, I don't know who raised their hand first, but Bruce, you're first in the squares on my screen. So why don't we call on you?
Thanks very much, Aaron. There's a lot of discussion in the last few days, last few weeks around how valuable it would have been to get the children and youth of this province back to in-person school, and certainly many of us are very disappointed that hasn't been done. But it really triggers a shout out to all of the folks across HHS who have children and youth at home due to school, and who are working virtually or working in person and juggling the increased pressures that creates. And so really want to shout out to everyone and acknowledge that's just been another demand and disruption on you, and you've handled it remarkably.
Thanks very much for that, Bruce. Dr. Ralph Meyer, I see you with your hand raised. What would you like to celebrate today?
Thanks, Aaron. I want to celebrate the clinical and laboratory teams responsible for the stem cell program. Every 3 years, we undergo this very grueling exercise for accreditation with something called FACT, which is the Foundation for the Accreditation of Cellular Therapies. It is a really big deal. It allows us to participate in international registries and have collect stem cells we collect here, go to other places in the world, and for our patients to get stem cells from donors and other places in the world. And it really validates us as having a top-notch program. The work for this takes months to prepare. It involves well in excess of 50 people to look at the clinical program, apheresis, and the lab. Tons of work for our head of transplant, Dr. Kylie Lepek, and our quality specialist, Ed Brindle. And I'm hesitant to name any other people because there's just so many involved. The process took place virtually over the last 2 days with accreditors from Atlanta, San Francisco, and Poland. They were effusive in their praise at the exit interview. We know enough that exit interviews don't necessarily always match the final report that comes from accreditation bodies, so we'll wait to get that. But the team did a phenomenal job in preparing and represented the organization and its mission very well. So congratulations and thank you to all of them.
Wonderful, great news. Thank you very much for that, Ralph.
Maybe, Aaron, we could go back over to the chat. I see another one from Jeannie Risk. Would like to give a shout out to all the DI and nuclear medicine staff for continuing to tirelessly work through the pandemic and providing excellent patient care, and would echo that, Jeannie, for sure. Thanks for that.
See another one here from Monica Bennett. Thank you to Bruce Squires for his role with Children's Healthcare Canada and the statement from that organization about the confirmation of Indigenous children's graves in Kamloops. It demonstrated clear leadership and responsibility for healthcare's role in this. Thank you for illuminating for our McMaster Children's Hospital being illuminated in orange to mark the significant event. Note our Ron Joyce Children's Health Center was also the same. So thank you, Monica, for raising that. And maybe Sharon, Ellen Lippman wanted to second Bruce's comments about the excellent advocacy regarding school opening. All right, well, we'll leave it there. Maybe Sharon, over to you for some closing thoughts.
Yes, great. Thanks, Aaron. Thank you, everybody, for joining. A special thanks to Ellen Lippman. Thanks to Ellen for participating today. And as always, thanks to Dominic for providing us with wonderful updates every week and keeping us all informed, along with Bruce, on the vaccine. So hope everybody has a good day. Thanks for participating. Thanks for getting vaccinated. And we'll see everybody next week. Have a good day.